Next, I want to invite Helen Howson from Swansea University. Helen's the director of the Bevin Commission, and she's going to talk to us about Prudent Health and Care. Helen, thank you.
So good morning, and thank you for the invitation to come here. It's a delight, and certainly what I'm going to do is add to Sally's insight into Wales, and I'd like to just introduce really the session by just bringing the dimension together. I represent the Bevin Commission. The Bevin Commission is an independent think tank for health and care in Wales. It is independent of government and other domains. And we were set up, in fact, by the minister at the time to observe, interpret, analyse, scrutinise, advise and comment on health and health-related matters. So we are the leading think tank, so we are in a position to be able to look at things from a different perspective, to look at through a different lens, and this is exactly what we do. But we do it by bringing together our 26 Bevin commissioners. They come from all over the world, not just all over the UK, and certainly not just from Wales. And some of them you may recognise, like Don Berwick, Professor Michael Marmot. We are chaired by Sir Mansell Aylward, and we have people like Dame Carol Black, and Sue Bailey. We have a number of great minds, and we are very, very privileged to be able to use those to help us think through what it is we need to do, or what we can best do to help us sustain health and care into the future, and that's where we're at. Sorry, just doing the flicker. Did work just then, but it isn't working now. Right, okay. So just to remind ourselves very briefly then, and Bevan invented, if you like, created the NHS, and it's useful to remind ourselves that actually it didn't spring from the mind of committees and meetings. It actually sprang from the minds of what was happening in communities, and we're very proud of that reality. But I think it's important to remind ourselves that the needs then were very different from the needs now, and indeed the challenges that we see for the future. It's important, therefore, that we reflect on this in any health and care system that we are working and looking to change. We know that there are many challenges facing us today. What we don't know is how and in what ways these challenges are going to turn into the future. And that is certainly something that the Commission looks at in many ways. In order to do that, then, I guess we challenge ourselves, and we're really interested in how do we overcome these challenges and make it relevant for the future. And I'm a great Einstein fan, and of course, you know, Einstein has said many times, I guess, in the past, you cannot solve a problem from the same consciousness that created it. And therefore, what we're about is trying to look through a different lens, trying to anticipate what the future might bring, and also try to find some of those solutions to those. To help us do that, we look at things through a different, as I said, through a different perspective. We have produced a number of publications, and for those of you who are interested, please go onto our website. Whether it's a workforce for the future, whether it's redrawing the relationship for the citizen of the state, or whether it's just about looking at how do we sustain health and care in the future. In 2013, we looked globally around to see what was happening. At the time, there was great concern about austerity, certainly in the UK and certainly in Wales, but globally the same problems exist. And what we then did was look around to see who was doing what and what might best suit the needs of Wales. We came up with a prudent solution, a prudent health and care solution, and I'd just like to highlight some of the key elements of this. For those of you who are interested in this in further detail, we've a workshop tomorrow, lunchtime. But essentially, as I said, it is the great minds that came together to think through this. And the slightly complex conclusion really was that healthcare is, in fact, conceived, managed and delivered in a cautious and safe and wise way, but characterised by forethought, vigilance and careful budgeting, which achieves tangible benefits and quality outcomes for patients. That's the really long definition that we worked in. We tested out this over at least 12 or 18 months working with practitioners, in order to come up with what we saw as 4 basic core principles, and it's these basic principles that now underpin the philosophy for Welsh Health and Care. The first one being achieving health and well-being with everyone as equal and co-partners in their process. This is about health, not just illness. This is about achieving health and how everyone together can achieve health. The second one is really about ensuring that we don't lose sight of those with greatest need. So it's about caring and remembering that actually we have a responsibility, and we heard earlier today how we're seeing health inequalities grow. Certainly in Wales we're seeing the gap get bigger. Caring for those with greatest need, greatest health needs first, but also making the best use of all skills and resources. This isn't just about money, this is about people, how we use their skills, and includes also what we call the wider workforce: patients, carers, voluntary sector, the public, our communities, you name it. They're all important assets, and we would argue they are absolutely key assets in a future solution. The third element is around doing only what is needed, no more, no less, and do no harm, of course. And yet we all see various aspects by which we don't do this. And it's just a reminder for us to say, hang on a minute, how do we make sure that we don't do harm? We know that the minute we often admit a frail elderly person to hospital, we're doing them harm. So the third element is that. The final element, the final principle by which we work, is reduce inappropriate variation using evidence-based practices consistently. And we know that there is inappropriate variation. We know that there is, a lack of evidence-based practice. We know, in fact, that there are, I think it's 167 interventions not normally used that are still used, and we heard it earlier. Leaving go of things that don't work, but also being open and opportune to things that we may not have all the ideas and all the answers for either. So Prudent Health and Care forms the basis of the work that we've advised both Welsh Government and we drive forward on. We then recognised that actually we weren't going far enough in this, and what we've subsequently developed really is this real, if you like, focus on the need to move from a medical model to a more social model, recognising that it's a shared responsibility of society, starting with the individual, a model which places responsibility on improving health and well-being across society as a whole. And for those of you who are interested, we developed 3 publications last year looking at this through 3 different lenses: a new way of thinking. It is certainly my belief that unless we think differently, we won't change much. It's the change in thinking that helps us change in practice. So the series there is a new way of thinking, a new way of planning, and a new way of doing. So for those of you interested in understanding that, please look at those publications. In order to take this forward, the Commission well recognises that you're never going to change the world through papers and publications. You're never going to change the world, I don't think, from the top down either. And actually what we realised very clearly was that unless you take people with you, unless people own this, unless people are actually driving this and are passionate about it, not much will change, because people are what makes things happen. And it's the thing that often stopped us in our tracks, and you can have the best ideas, the best thought through plans, but it don't work. And so we've taken a very open perspective and thought, right, how do we do this? How do we engage people, whether they are professionals or the public, in creating a wider social movement for change, not just something that is driven top down? And this is an indication of the kind of pieces of work that we're working with. We're working with the Welsh Medical Committee, we're working with RCGP, Welsh Pharmacy Society, but also with a whole range of other groups that can influence and help make our thinking more of a reality in practice. And we firmly believe it's the people in the system and those who use the system that are best placed to actually change the system. And therefore the Commission really took a turn about 4 or 5 years ago that actually, unless we took some movement and some emphasis in trying to make a difference in this, that nothing much would change. And so we created what we called really the Bevan Innovators. This is comprised of 3 different groupings. Bevan advocates, who are members of the public. Are you passionate about the NHS? Are you passionate about health? Then come and join us. The Bevan Fellows are new early career, or at least they were early career clinicians who we invited to come along with us. We now have later clinicians also wanting to be a fellow, but also our Bevan exemplars. And at the time, these were anybody in the NHS with a great innovative idea. This isn't just about improvement, this is about innovation, trying to think really differently. And that doesn't mean to say we don't need improvement as well. So our Bevan exemplars are people in the system who we're encouraging to come forward with your ideas and we'll help you. This is just one report that we did with our Bevan advocates, where we heard from our people who are members of our public who say, actually, why wouldn't we want to ensure that the public are involved? And this is one of the patient-driven solutions we produced. But we also have a number of examples whereby, this was a GP example, whereby a GP, and we heard earlier, how do we do this? Transform the way his surgery worked, and he is one of our exemplars. We also have people like organisations that use VR and AI, and they've come together to try out and test their ideas, and even down to things like waste from hospitals. The bottom line in all of this is really about the need to change.
Innovation is of supreme importance in healthcare. In fact, if there were no innovation, there would be no advances.
The Bevan exemplars are trying out new things, processes, services, products, as a means of innovation in healthcare and transforming healthcare services to meet the needs of the future.
It is the people who are in the system and the people who use the system who are going to fundamentally help us change the system.
I think the Bevan Exemplar scheme is so valuable to Wales. It certainly has opened up doors and has given me an audience and a chance to speak with a lot of people that I wouldn't necessarily have had the opportunity to.
It's come to a point in health and social care where we need to be heard, and this was a way of having a voice.
There was a big peer support aspect, I think, of the Bevan exemplar projects. We're able to kind of upscale ideas very quickly across the country if we know that they work.
Being able to say that I had a Bevin Commission project, it gives a seal of approval, gives more kudos to your project, and that's really supportive and gave me a lot more confidence to carry on.
Bevan has allowed us to consolidate our relationships with our local director and our local management team, which has been really important.
The clinical pressures are growing year on year, as we're all aware of, and allowing some time and some space and some expertise is vital. It was about the issues around developing a social movement about health and social care that attracted me most about the Bevin Commission, and to encourage a spirit of innovation that would allow us to do something almost on a societal basis to change the way that we look at health and social care. I do believe the NHS is thinking differently. It has to, but it is starting to do that.
If you have an organisation like the Bevin Commission who see how positive changes can improve efficiency and effectiveness, improve patient outcomes, improve patient satisfaction, then that's the way for the NHS to move forward and in fact thrive.
The future is about how do we upscale these great ideas that we've unpacked. We're only hitting the tip of the iceberg here.
Future-wise, I would love to be taking the programme and the programme's approaches a little bit further to help the spread and the scale within the NHS.
I think the future is a glorious one. We want a revolution from within, and the exemplars are one of the ways in which we can capture innovation and make sure that we do in fact achieve a step change in the health of the people of Wales.
And just to conclude really, we started off something we had no idea what we started. We didn't know what it would produce, but the evidence, we're into our 5th cohort. We have approximately 40, we've got 54 this year. But just to give you an idea of some of the data that we've got, the independent evaluation here, we're on our 4th, completion of our 4th cohort. And it is interesting that what we're seeing is in the region of an 80% success rate at the end of a 12-month period. We only give them 12 months to develop their ideas, and other tangible benefits that you can see there. The other thing that we do is make sure that we are trying to scale, adopt and spread the ideas, and we're working on that now with Welsh Government as a major piece of work in taking these ideas forward. So in conclusion then, really, we cannot keep doing the same thing, and as Albert Einstein says, insanity is doing that same thing over and over again and expecting different results. Thank you very much.